Teratoma, a germ cell tumor, shows the differentiation along the embryonic rather than the extra-embryonic pathway. These are grouped together as a teratoma and divided into three categories: mature, meaning dermoid cyst; immature, essential malignant solid teratoma; the monodermal or the highly specialized stroma, ovary. Dermoid cyst unilocular with a smooth surface, sebaceous material and hair, and the wall is lined by the squamous epithelium which contains the hair follicles and the sebaceous gland. Teeth, bone, cartilage, thyroid tissue, and the bronchial mucous membrane, they are often found in the wall in the inner surface is called the focus or the embryonic node. Ectodermal or the mesoderm and the endoderm. Squamous epithelium usually lines the cyst. Columnar and the transitional types are also found. Arise in the association with the mucinous cystadenoma to form the combined tumor, part of which consists of the dermoid cyst, while the rest has a characteristic structure of the mucinous cystadenoma. Most common orbital cyst in the children is the dermoid cyst. Most common ovarian tumor in the pregnancy is dermoid cyst. Dermoid cyst is most prone to undergo the torsion during the pregnancy. Extra-ovarian dermoid cysts arise occasionally in the lumbar region, uterovesical area, parasacral region, and the rectovaginal septum. Epitomic carcinoma and the acromatous changes may occur. Solid teratoma of the ovary. Tumor containing the cells of all this germ layer is called the teratoma. Dermoid cyst of the ovary is a teratoma. Teratoma arises from the totipotent cells. Cut surface has a peculiar trabeculated appearance. Large loculi are found beneath the capsule. Solid part of the tumor contains a plain muscle brain tissue, ilia pyramida cartilage, bone, and the intestinal mucous membrane. Cystic spaces contains the hair and the sebaceous material. In children, the differentiated mature teratoma may be benign. Rockitansky protuberance, where the tissue elements such as tooth, bone, cartilage, and the various other odd tissues are present, is seen in the one area of the cyst wall as a solid prominence. In pubertal males, all teratoma are regarded as a malignant and are capable of metastasis regardless the elements may be immature of the mature. 10% of the B and the malignant. Sacrococcygeal teratoma is associated with a defect during the castration. Maximum radio-opaque shadow in the ovary is seen in the teratoma. Mostly malignant tumors because of the sacromatous changes. Stroma ovary consists of the thyroid tissue similar to that of the thyroid adenoma. The tumor is solid, consisting almost entirely of the thyroid tissue. The tumor resembles a small mucinous cystadenoma, but the material paste contained in the vesicle is called the colloid and gives reactions to the iodine. The stage of a cancer cells that you have where it was grown. In the ovarian teratoma, there are 4 stages from 1 to 4. Stage 1 means a cancer is only in the ovary. Stage 2 means a cancer has spread to the fallopian tube, womb, or elsewhere in the area circled by the hip bones, your pelvis. Stage 3 means a cancer has spread to the lymph nodes or to the tissues lining the abdomen called the peritoneum. Stage 4 means a cancer has spread to the another body organ some distances away, for example lungs. Diagnosis. As most cysts are the asymptomatic shows no symptom, they are most likely to be discovered during the routine pelvic examination or while undergoing an ultrasound scan for the another reason such as pregnancy. An abdominal and the transvaginal ultrasound will be carried out to determine the exact type, location, size, and amount of cyst present. Ovarian mass with the X-ray pelvis shows the radio-opaque shadow such as the dermoid cyst. Beta HCG, both seminoma and non-seminoma. AFP, only non-seminoma. LDH, both seminoma and non-seminoma. If left untreated, the ovarian torsion can develop. This can restrict the blood flow to the ovaries and eventually cause a fertility problem. Unless a cyst rupture causing an emergency, surgery is usually elective. The dermoid cyst in the pregnancy should be treated at 14 to 16 weeks of pregnancy. Cystectomy, total oophorectomy, partial oophorectomy, and the laparoscopy assisted vaginal hysteroscopy. Most common orbital cyst in the children dermoid cyst. Sacrococcygeal teratoma appear as swelling over the sacral region. Maximum radio-opaque shadow in ovary is seen in the teratoma. Ovarian mass with X-ray pelvis showing the radio-opaque shadow suggests the dermoid cyst. Rockitansky protuberance are seen in the teratoma. Dermoid cyst of the ovary is teratoma. Dermoid cyst is most prone to undergo the torsion during the pregnancy. The cyst of ovary contains the derivatives called from the endoderm, mesoderm, and the ectoderm. Most common ovarian tumor in the pregnancy is dermoid cyst. The dermoid cyst of the ovary has a sebaceous material. Dermoid cyst of the ovary commonly more than 10 cm. Teratoma arises from the totipotent cells. In the benign cystic teratoma, 10% of the B and L are the malignant. Testicular teratoma markers are the beta HCG, AFP, and LDH. The teratoma in the adult is a malignant lower abdominal mass which shows a well-formed tooth on the plain X-ray is suggestive of the mature cystic teratoma. Sacrococcygeal teratoma is associated with a defect during the gastration. The dermal cyst diagnosed at the 6 weeks of the pregnancy should be treated at 14 to 16 weeks of pregnancy. Tumor containing cells of all three germ layer is called the teratoma.